Hygiene is something we take very seriously here. We have to operate to exactly the same levels of hygiene that you would see in a general hospital. In a small operation, it becomes quite complicated. So basically, when the instruments come back from the patients, which these haven't touched yet, these go into this cupboard here, the non-clean area. So everything in there is deemed to be contaminated. And then we don't have to move instruments around the rest of the building. We just literally pass them through there, and then we go through into the LDU, which is our instrument decontamination unit. In the instrument room, there's a whole series of processes that have to take place in a very structured, more importantly, validatable way. We have to be able to prove that all of these processes have been carried out correctly. So instruments, which we'll pretend are dirty, come back through to here, are unpacked, and then into the washer disinfector. This is a W&H, which is the best one you can buy. And then they come back out for visual inspection. Once the instruments come back out onto here, they then will go into the ultrasonic bath. This is a data logged ultrasonic bath, so everything about it's computerized. It tests its own parameters and gives us our readouts for our log for later. And then the visual inspection happens here, where the nurse or the technician will take each individual instrument from the cassette and have a good look around under magnification and light, just to make sure there's nothing on there that shouldn't be. Then we move on to the next section, where the hand pieces are cleaned. Our drills, as people would call them, are actually very complicated pieces of equipment, and they do not like some of the processes that take place in the LDU. So this Assistina is a fully automated instrument cleaning device. Basically, it oils them, cleans them, and they're as good as new and ready to go into the autoclave at that stage. This is where we make our own steri bags. So basically, we can customize the bags to the shape and size of the instruments that we're using. Amy loves this because it makes life nice and neat. And this is the little guillotine heaty stampy thing, which is all very good. The instruments are then packaged in this section here. We're now moving from the non-clean area in a linear progress to the clean area. And obviously we have to take a step over here, and the instruments go into the Lisa, which again is a very complicated piece of equipment. Austrian, very expensive, but works a treat. And this machine will test itself all the way through the parameters, just to make sure that every single stage of the vacuum cycle and the autoclaving cycle has been carried out correctly. And then the instruments come out onto here. Now, if you come in, you can just see each bag comes with a unique reference number, which is very important to us because traceability and validatability of our processes are, we don't have to do it, but we think it's very important that we can. Entries are then made into the log, so each unique reference number relates back to successful washer-dryer cycle, ultrasonic cycle, visual inspection, and the autoclave. We now know, if I wanted to, I could treat the Queen with these instruments. They couldn't be cleaner. If a patient ever suspects that something's been caused by dirty instruments, this can prove, without doubt, every single process has been carried out to the highest possible standard. And then everything goes back through the other hatch, passed back through to the surgery. Again, no instruments have to be carried around in front of people in the rest of the building. And from the hygiene surgery, we have the dirty instruments come through this way, go through exactly the same process, and then the instruments come back into the surgery through the clean hatch.